So now we're going to start the larynx. See, larynx is nothing but it is a tube. It is a cartilage tube which is extending from the vertebra C3 to C6. Now, which contains the paired cartilage and the unpaired cartilage. I told it's a cartilage tube which contains paired cartilage and the unpaired cartilage. Now, we're going to draw some line diagram and then we see the diagram. Now, if you see the anterior view of the larynx, which contains the cricoid cartilage, in the front side cricoid, it is forming one small arch, and above the cricoid cartilage, we have thyroid cartilage. Thyroid cartilage is like a shield. This is the thyroid cartilage, and above the thyroid cartilage, yes, we have one leaf-like cartilage, that is our epiglottis. So in the front side of the larynx, we see cricoid cartilage, thyroid cartilage and epiglottis. And please remember, these three cartilages are unpaired cartilages. They are unpaired. We have a single cartilage. So in the back side, posterior view, we see some more cartilage. Okay. Now in the back side, yes, the cricoid cartilage, the back side, it forms one broad lamina. So cricoid is a only cartilage which forms one complete ring. In the front side, it is forming one small narrow part, and in the back side, it is forming one broad lamina. So please write one small box and then write cricoid is a only cartilage. Cricoid is the only cartilage which forms one complete ring. Which forms one complete ring. Okay, right. Now above the lamina, we have arytenoid cartilage. This is arytenoid, paired cartilage. Okay, so this is arytenoid. And above the arytenoid, we have corniculate and cuneiform. Corniculate and cuneiform. Above the arytenoid, we have corniculate and cuneiform. So arytenoid, corniculate and cuneiform, these three cartilages are paired cartilages. Okay. 2021 FMG exam, they gave this question. All the following are the paired cartilage except. Okay. FMG exam, we got this question. Now, one more point we have to know about these cartilages. Now, what type of cartilages are these? Now, in the larynx, the thyroid cartilage, the cricoid cartilage, and the arytenoid, they are hyaline cartilage. So, thyroid, it is a hyaline cartilage. Cricoid cartilage, hyaline cartilage. And arytenoid, hyaline cartilage. So, three cartilages are hyaline: thyroid, cricoid, and arytenoid. And the three cartilages, cuneiform, corniculate, and epiglottis. These three cartilages are elastic cartilage. So, elastic cartilage, epiglottis, corniculate, and cuneiform, these three cartilages are elastic. So, we have three hyaline cartilage and three elastic cartilage. Now, one important thing is the arytenoid. See, arytenoid, I told you it is a hyaline cartilage, but the apex of the arytenoid is elastic. The apex of the arytenoid is elastic cartilage. This is very important. If they ask arytenoid, you have to write hyaline only. If they mention specifically about the apex of the arytenoid, then that is elastic cartilage, and it is the question you will get into exam. This is expected. Okay, right. So this is about the larynx and their cartilages. Now see the diagram. So we drawn the line diagram. So actual diagram will be like this. So yes, this is a front view of the larynx. This is anterior view, first diagram. So the front side, we are seeing epiglottis and the thyroid cartilage and the cricoid cartilage. So the front side, we are seeing one small arch. The back side, the cricoid cartilage is forming cricoid lamina, a broad lamina, cricoid lamina. And above the cricoid, yes, this is our arytenoid. And above the arytenoid, this is corniculate. And above that, we have cuneiform. Okay, yes. So this is about the cartilages of larynx. Okay, right. Next, we're going to see the parts of the arytenoid. because most of the muscles attaching to arytenoid only. So we have to know the parts of the arytenoid. So the arytenoid cartilage will be like this, having the apex, base. Now this is the apex of the arytenoid. This is the base of the arytenoid. And apart from apex and base, we have two processes. Now processes are nothing but extensions. So we have the vocal process and muscular process. So these are all the parts of our arytenoid. Now the base of the arytenoid is resting on the cricoid lamina. It is resting on the cricoid lamina. Cricoid lamina. And this is a vocal process. The vocal process which gives attachment to the vocal ligament. And this is muscular process which gives attachment to muscles. Two muscles. In the front side of the muscular process, we have lateral cricoarytenoid muscle. In the posterior part of the muscular process, posterior cricoarytenoid muscle. Okay, so muscular process which gives attachment to two muscles, one in the front side, one in the back side. In the front side, lateral cricoarytenoid muscle. In the back side, posterior cricoarytenoid muscle. Clear? Right, these are the various parts of our arytenoid. Now in the cut section, diagram will be like this. So we have taken the cut section. So larynx is there. So we have taken the cut section like this. So in the cut section, in the front side, we see the thyroid lamina. So this is our thyroid lamina. And we are seeing the arytenoid. Okay. Now arytenoid, this process is called vocal process. So vocal process which gives attachment to the vocal ligament. Okay. And this is our muscular process which gives attachment to muscles. Okay. Right. And the base is resting on the cricoid lamina. Fine. Next one. We're going to take the coronal section of larynx. We're going to take the section. Larynx tube is like this. And we're going to cut the larynx in the front view. In the coronal view, we're going to cut like this. So if you cut the larynx in the coronal view, in the frontal view, now on either side, see, we are cutting the thyroid shield here. So the thyroid cartilage will be like the two horns on either side, like this. And below thyroid cartilage, you see the cricoid cartilage. See the diagram? Now this is our thyroid cartilage. Because in the front side, we removed the lamina. We made a frontal section like this. So we are removing the thyroid lamina. So thyroid cartilage is seen like the two horns on either side like this. And below thyroid cartilage, we are seeing the cricoid cartilage. So understand the diagram first. Okay. And above the thyroid cartilage, we are seeing this small bone. There is a hyoid bone. Okay. Right. Now, see this membrane. Now in this diagram, we are seeing two membranes. What are those? Quadrangular membrane. And another membrane is a cricovocal membrane. Now the quadrangular membrane, the lower part is going for thickening and it forms the vestibular ligament, and that is our false vocal cord. So what is vestibular ligament? Vestibular ligament is nothing but it is a thickening of the lower part of quadrangular membrane. Thickening of the lower part of quadrangular membrane. Quadrangular membrane. That is the vestibular ligament. And we also have one more membrane called cricovocal membrane. Now, cricovocal membrane, the upper part of cricovocal membrane, it is going for thickening and forms one ligament. What ligament? That is a true vocal cord. That is the vocal ligament. So we have two ligaments, vestibular ligament and the vocal ligament, false vocal cord and the true vocal cord. The false vocal cord or vestibular ligament is nothing but thickening of lower part of quadrangular membrane. Very good. The true vocal cord, the vocal ligament, is a thickening of upper part of cricovocal membrane. Okay? Right. Next one. Now, these quadrangular membrane and the cricovocal membrane, these are the membranes which present inside the larynx, present within the larynx. So, these membranes are called intrinsic membrane of larynx. So, intrinsic membranes of the larynx. What are those? So, these membranes present within the larynx. Okay. So, we have quadrangular membrane. We have quadrangular membrane. We have cricovocal membrane, cricovocal membrane, and we have cricothyroid membrane, cricothyroid ligament or cricothyroid membrane. See, cricothyroid membrane, it is the only intrinsic membrane which is present outside. See here, this is our cricothyroid. So it is contained in the cricoid cartilage and thyroid cartilage only. So they connect present within the larynx. But this intrinsic membrane is the only intrinsic membrane which is present outside. So cricothyroid membrane, it is the only intrinsic membrane which is present outside. Okay. So we have one more intrinsic membrane, that is thyroepiglottic. Okay. Right. Now, these are the intrinsic membranes. Now, apart from this, we also have extrinsic membranes. See, extrinsic membrane, they connect the larynx to the other parts. Connect the larynx to the other structures. Okay. So we have thyrohyoid membrane. So which connects the thyroid cartilage to the hyoid bone. So thyrohyoid membrane is the extrinsic membrane. Thyrohyoid membrane. Number 1. Number 2. Hyoepiglottic. Hyoepiglottic. From the hyoid bone to the epiglottis. Hyoepiglottic. And number 3. Cricotracheal ligament. Cricotracheal ligament. From the cricoid cartilage to trachea. Cricotracheal ligament. So these are the extrinsic membranes. So extrinsic membranes, nothing but they connect the larynx to the other parts, to the hyoid bone and to trachea. Okay, right. So we have two membranes, intrinsic membranes and the outer extrinsic membranes. Right. So now in the coronal section, we're going to see the subdivisions of larynx. Okay. So subdivisions of larynx. Now this is a laryngeal inlet. So from the laryngeal inlet up to the vestibular ligament, I'm going to mark this area as number 1. So number 1, that is called vestibule or supraglottic compartment, supraglottis, which is extending from the laryngeal inlet, up to the vestibular ligament, and this is number 2. That is from the vestibular ligament up to the vocal ligament. So number 2, from vestibular ligament to the vocal ligament, and that is called ventricle or glottis. So which is extending from the vestibular ligament to the vocal ligament. Okay. Number 3, from the vocal ligament, this is number 3. So from the vocal ligament up to the lower border of cricoid cartilage, that is called infraglottis or subglottis. Subglottis or infraglottis. That is from vocal ligament to the cricoid cartilage. So these are the 3 subdivisions of larynx. Okay. So what are those? Supraglottis, glottis and subglottis. So supraglottis extending from laryngeal inlet up to the vestibular ligament, the glottis from the vestibular ligament to the vocal ligament, and subglottis from the vocal ligament up to the lower border of cricoid cartilage. Right. Now please remember, the supraglottis is supplied by internal laryngeal nerve. The sensory fibers from the supraglottis is carried by internal laryngeal nerve. So supraglottis, please write, sensory supply by internal laryngeal nerve. Sensory fibers from the supraglottis. Now what about the subglottis? Subglottis, the sensory fibers are carried by recurrent laryngeal nerve. Subglottis, the sensory fibers are carried by recurrent laryngeal nerve. So supraglottis, interlaryngeal nerve, subglottis, recurrent laryngeal nerve. Now the question is, who will supply the glottis? So glottis sensory fibers by both recurrent laryngeal nerve and internal laryngeal nerve. Both will supply the glottis. Then what is the best answer, sir? Recurrent laryngeal nerve greater than internal laryngeal nerve. That is the best answer. So glottis is supplied by both nerves, recurrent laryngeal nerve and internal laryngeal nerve. The best answer is recurrent laryngeal nerve greater than internal laryngeal nerve. That is sensory supply of glottis. Okay, sometimes this recurrent laryngeal nerve and the internal laryngeal nerve, they go for anastomosis. That is called a sensory anastomosis, and that is called Gallen's anastomosis. So Gallen's anastomosis is the sensory anastomosis. Sensory anastomosis between internal laryngeal nerve and recurrent laryngeal nerve. Okay, right. Now, see the diagram. Now, what will happen if the patient is having the internal laryngeal nerve damage? So, internal laryngeal nerve damage means the sensory fibers, the sensation from the supraglottis is lost. So, if any foreign body entering the supraglottis, then the patient is not able to feel those foreign body because the internal laryngeal nerve damage. So, patient may have aspiration pneumonia. So, aspiration pneumonia is due to involvement of which nerve? Internal laryngeal nerve. So, please write one more point. So, aspiration pneumonia. So, aspiration pneumonia is due to injury of which nerve? Internal laryngeal nerve. So, internal laryngeal nerve damage means the patient is not able to feel any foreign body entering the larynx. So, that is why the internal laryngeal nerve is also called as safety nerve of larynx. Internal laryngeal nerve acts as a watchdog. So, if any foreign body comes in contact with the larynx, immediately it produces a cough reflex and that propels the foreign body. That is why internal laryngeal nerve is called what nerve? Safety nerve of larynx. Is that clear? So, aspiration pneumonia due to? Yes, internal laryngeal nerve damage. Internal laryngeal nerve, that is why it is called what nerve? Safety nerve of larynx. Clear? Right. Now, few more points I want to add to this diagram. Now, number one, we have three compartments in the larynx: supraglottis, glottis, and subglottis. Now, carcinoma, cancer is most commonly seen in which compartment? Supraglottis, glottis, or subglottis? Very good. Glottis. So, glottis carcinoma is most common. So, cancer is most commonly seen in glottis greater than supraglottis greater than subglottis. This is the order. So, cancer is most commonly seen in glottis greater than supraglottis greater than subglottis. Clear? Right. Next one. Now, which carcinoma is having good prognosis? So, cancer, carcinoma with good prognosis. With good prognosis. Again, CA glottis only. Why, sir? CA glottis is a carcinoma having good prognosis in larynx. Why? Because in glottis, we don't have lymphatics. No lymphatics. So, lymphatics absent in glottis. So, that is why CA larynx, CA glottis having good prognosis. Again, CA glottis, which present at the early stage itself. Present at the early stage itself. So, patient come to doctor at the early stage itself so that we can intervene as early as possible. So, CA glottis is having good prognosis because of two reasons. Number one, no lymphatics and present in the patient at the early stage itself. Okay? Right. So, that's all about the applied aspect of the subdivisions of larynx. Now, two more points I want to add to this diagram. So, I told you the vestibular ligament is nothing but the thickening of the lower part of quadrangular membrane, and the vocal ligament is nothing but thickening of the upper part of cricovocal membrane. Now, we have some space between the two vestibular ligament. I'm going to mark that as A. And we have a space between the two vocal ligament, and that is called B. So, what is A and B? So, A is the space between the two vestibular ligament. So, that space is called rima vestibuli. So, B is a space between the two vocal ligament. That is called rima glottidis. rima glottis. Okay, so we have rima vestibuli and rima glottis. Now we are seeing the rima glottis. Okay, the space between the two vocal ligament. Now we're going to divide the space into intermembranous part and the intercartilage part. So for this we draw one diagram. Now again it's a cut section diagram. Now in the front side, this is our thyroid cartilage like a shield, and this is our arytenoid, and this is a ligament. What ligament? That is a vocal ligament from the vocal process. Right. So now this space, this entire space is called rima glottis. So rima glottis, yes, the space between the two vocal ligament. Now we have two parts of the rima glottis, number 1 and number 2. Number 1, this part is present between the two ligament. So the one which I am shading in yellow color, okay, that is called intermembranous part. Intermembranous part. And number 2, this one. Now again this rima glottis present between the two arytenoid. Okay, so this is called intercartilage part. Intercartilage part. Okay, so rima glottis we are subdividing into intermembranous part and intercartilage part. Okay, right. So now with this idea and background, we're going to see the muscles of larynx. Okay, so now we're going to start the muscles of larynx. So first we draw some line diagrams and then we can see the actual diagram. Okay, so now first muscle, cricothyroid muscle. So cricothyroid muscle. So this is the front side. So we are seeing the thyroid cartilage. This is the thyroid lamina. Below the thyroid cartilage, this is the cricoid cartilage, cricoid arch. Now between the cricoid cartilage and the thyroid cartilage, we have a muscle. So this is our cricothyroid muscle. This is our cricothyroid muscle from the cricoid cartilage to the thyroid cartilage. Okay. Now what is the action of this muscle? See, I told you cricoid is the only cartilage which forms one complete ring. Okay, so cricoid arch move towards the thyroid cartilage. I told you in the muscles of mastication itself. If you want to know the action of any muscle, please remember origin point is a fixed one and the insertion point move towards the origin point. So the cricoid arch, the cricoid cartilage move towards the thyroid cartilage. I told you cricoid is forming one complete ring. In ring, if one end is going superiorly, if one end is moving upward, then see the other end. The other end automatically moves downward. So the cricoid arch moves superiorly towards the thyroid cartilage and the lamina will move down. The cricoid lamina will move down. Okay. So what is the action of this muscle? So first point, the cricoid arch move towards the thyroid cartilage. First point. Okay. Now because of this, the cricoid lamina move down. The cricoid lamina move down. Because in ring, one end moves superiorly, the other end moves inferiorly. One end is moving upward, the other end is moving downward. Ring, one end is moving superior and automatically the other end will move down. Okay. Cricoid lamina is moving down. So above the lamina, we have one cartilage. What is it? Arytenoid. So arytenoid cartilage moves down. Why? Because lamina is moving down. Above the lamina only we have arytenoid. So arytenoid also move down. If the arytenoid is moving down, then we have one ligament from the arytenoid to the thyroid cartilage. What's the name of the ligament? Vocal ligament. So vocal ligament move down. Now ligament is moving down. So because of that, the ligament is stretched. The length of the ligament will increase. So what about the tension? The tension of the vocal ligament increases. So what is the action of this muscle? This muscle increases the tension of the vocal cord. It is the tensor of the vocal cord, cricothyroid muscle. Clear? Now, while increasing the tension, this muscle also have adduction. So this muscle also adducts the vocal cord, but that is not a main action. Cricothyroid muscle main action is increasing the tension of the vocal cord. And while increasing the tension, the muscle also move the vocal cord medially. So the action of this muscle is tensor greater than adductor. So again, the Gray's anatomy, they were saying that the recent edition Gray's, they were saying that the cricothyroid muscle, they are convinced only with the tensor of the vocal cord action only. And they are saying that there is no concrete evidence, there is no substantial evidence to prove the adduction property of cricothyroid muscle. But in all the ENT books, they are saying that this muscle is having two actions. Cricothyroid muscle is having two actions. Number one, increase the tension of the vocal cord. And number two, this muscle also adducts the vocal cord. So we have to know the two actions. The best action is tensor greater than adductor. Clear? Right. That's all about the cricothyroid muscle. Next muscle. Now we're going to take the cut section of larynx. So here we're going to see cricoarytenoid muscle. We have two muscles, lateral and posterior. Now for this, we're going to take the cut section of larynx. So cut section of larynx means in the front side, we see the thyroid cartilage. This is a thyroid lamina. And this is our arytenoid. Now from the arytenoid, we have the ligament, and that is our vocal ligament. Right. Now we have a muscle. What muscle? That muscle is coming from the cricoid lamina and attached to the muscular process on the back side. So that muscle is our posterior cricoarytenoid muscle. So muscle is coming from cricoid lamina, attaching to the muscular process on the back side. Okay. Right. Now what this muscle will do, sir? See the diagram. Now this muscle rotate the muscular process on the back side. Yes or no? So this muscle rotate the muscular process on the back side. Now because of that, the apex rotate outward like this. The apex rotate outside like this. See, the muscular process is moving posteriorly. Now because of that, apex will be here. Now apex is rotating outside. Now by this action, the space between the ligament will increase or decrease. The cartilage is moving away. So space between the ligament will increase. Very good. So this muscle increase the space between the ligament, and that is called abduction. So abduction of vocal cord is done by which muscle? Posterior cricoarytenoid muscle. And please remember, it is the muscle, it is the only muscle which abducts the vocal cord. That is why the posterior cricoarytenoid muscle is called what muscle? Safety muscle of larynx. This muscle is called safety muscle of larynx because it is the only muscle which do abduction. Clear? Right. Next, we're going to draw the same diagram for the lateral cricoarytenoid muscle. Now again, front side. This is thyroid cartilage. Okay. And this is our arytenoid. Okay. And this is the ligament, vocal ligament. So now we have a muscle. That muscle in the front side like this. So this muscle is attached to the muscular process in the front side, and that muscle is our lateral cricoarytenoid muscle. Right. So now this muscle attached to the muscular process in the front side. So muscular process rotate in the front side like this. Will move in the front side like this. Now because of this, now this apex rotate inside and this apex rotates inside. So the two cartilages are like this and they're rotating like this. They're rotating inside. Now by doing this, the space between the ligament will decrease. So that is called adduction. Adduction of vocal cord is done by which muscle? Our lateral cricoarytenoid muscle. Okay. Now this muscle adducts this part of glottis. Adducts the intermembranous part of glottis. Adduction is sufficient. So very rarely you may get the specific question. The adduction of intermembranous part of glottis is done by our lateral cricoid muscle. So to be on safer side, yes, please remember, please know the specific answer. Adduction of intermembranous part of the vocal ligament is done by which muscle? Lateral cricoid muscle. The ligament is moving here like this. Okay, right. So next again we're going to draw the same diagram. So the front side, so this is thyroid lamina, and this is our arytenoid, and this is our ligament, that is our vocal ligament, and we have a muscle which connect the arytenoid of two sides. This muscle is transverse arytenoid muscle. Transverse arytenoid muscle. Now what is the action of this muscle? Now this muscle bring the two arytenoid cartilage close together. Okay, so again this muscle adducts the vocal cord, and this muscle adducts this part. So the one which I gave question mark, that part is called intercartilage part of glottis. Yes, so adducts the intercartilage part of the vocal ligament. Intercartilage part. Okay, right. So till now we discussed 4 muscles. Number 1, cricothyroid muscle. Now cricothyroid muscle, what is action? Tensor greater than adductor. Very good. Number 2, posterior cricoarytenoid muscle. Posterior cricoarytenoid muscle is a only muscle which abducts the vocal cord. Very good. Adduction of vocal cord is done by 2 muscles. Now please put one box and then write adduction of vocal cord. So adduction of vocal cord is done by 2 muscles. Adduction of intermembranous part is done by which muscle? Lateral cricoarytenoid muscle. Adduction of intercartilage part is done by transverse arytenoid muscle. Transverse arytenoid muscle. Okay, right. Now next we're going to draw one more diagram. That muscle is thyroarytenoid muscle. Now the same diagram itself we will draw. Now this muscle is our thyroarytenoid muscle. So muscle is coming from the thyroid cartilage to arytenoid like this. Thyroarytenoid muscle. Okay. So thyroarytenoid muscle from the arytenoid to thyroid cartilage. Thyroarytenoid. Okay. Right. So now thyroarytenoid muscle, because of this muscle, thyroarytenoid muscle. Now thyroarytenoid muscle between the arytenoid cartilage to thyroid cartilage. Now what is action? Now because of this muscle, the arytenoid cartilage moved towards thyroid cartilage. The distance between the thyroid cartilage and the arytenoid decrease. Now we have a ligament between these two cartilage, vocal ligament. So vocal ligament length will decrease and this muscle will relax the vocal cord. The length is decreasing means yes, the vocal cord is going for relax. So thyroarytenoid muscle relax the vocal cord. Okay, and we have one more muscle. See, that muscle is nothing but the detached part of thyroarytenoid muscle like this. Now this muscle is our vocalis muscle. So this muscle is vocalis like this. So I'm drawing on only one side. So this blue color muscle what I drawn there, that is the vocalis muscle. So please write, this vocalis muscle is nothing but detached part of which muscle? Detached part of thyroarytenoid muscle. Thyroarytenoid muscle, which joins with the vocal ligament in the anterior 1/3. So what is the action of this muscle? See, in the posterior segment, I told you this muscle detached part of thyroarytenoid muscle. So in the posterior part, the muscle have action similar to thyroarytenoid. So the posterior part of vocalis muscle relax the vocal cord. Now in the anterior 1/3 of the vocalis muscle blends with the vocal ligament. So the anterior part of vocalis muscle increase the tension of the vocal cord. So vocalis muscle having 2 actions. The anterior part of vocalis increase the tension of the vocal cord. Posterior part of vocalis relax the vocal cord. Okay, right. So now see the diagram. We have two more muscles. So first we see the diagram and then we proceed. Now this is the back view, posterior view of the larynx. So the posterior view of larynx, yes, we are seeing from the cricoid lamina to the arytenoid. This is the lamina. This is arytenoid. So here we have posterior cricoarytenoid muscle. Okay, right. Now see this diagram. Now in this diagram, yes, we are seeing the cricothyroid muscle from the cricoid cartilage to the thyroid cartilage, and again we are seeing posterior cricoarytenoid muscle, lateral cricoarytenoid muscle, thyroarytenoid muscle from thyroid cartilage to arytenoid, and we have two muscles which act on the laryngeal inlet. So muscles which act on the laryngeal inlet. Muscles which act on the laryngeal inlet. What are the muscles? We have two muscles. One is thyroepiglotticus, another one is aryepiglotticus muscle. See, from the thyroid cartilage to epiglottis, from the arytenoid to epiglottis, thyroepiglotticus and aryepiglotticus. Now see this muscle, thyroepiglotticus muscle. Now thyroepiglotticus muscle, this muscle will move the epiglottis towards the thyroid cartilage like this. So epiglottis will be moving towards the thyroid cartilage. That is thyroepiglotticus muscle. So this muscle widens the laryngeal inlet. That means this muscle opens the laryngeal inlet. So opening of the laryngeal inlet. Opening of laryngeal inlet is done by thyroepiglotticus muscle. Thyroepiglotticus muscle. Okay, and the closing of the laryngeal inlet is done by the aryepiglotticus muscle. Aryepiglotticus muscle. Okay, right. These are two muscles which open and close the laryngeal inlet. Okay. Now this image. Now in this image, we're going to identify these muscles, the cut section image, and we're going to identify all the muscles of larynx. Now the cut section image. So in the front side, we are seeing this cartilage, that is thyroid cartilage, and see this is the cricoid cartilage. See cricoid cartilage. See the diagram. It is forming one complete ring like this. Okay. So that is our cricoid cartilage. That is a cricoid lamina backside. Now above the lamina, can you see the cartilage here? What is it? Very good. That is arytenoid. That is our arytenoid. Okay. And we are seeing this extension. That is the muscular process of the arytenoid. Muscular process of the arytenoid. Okay. Right. Now see the first muscle. See, first muscle is coming from the cricoid lamina to the muscular process on the back side. So what is number one? Posterior cricoarytenoid. So one which is marked, that is our posterior cricoarytenoid. Number two. Again number two is coming from the cricoid cartilage. It is going to the muscular process in the front side. And muscle is present on the lateral side. Okay. Lateral cricoarytenoid. The muscle is present on the lateral side and the muscle attached to muscular process of the arytenoid in the front side. Okay. So don't get confused. That muscle is our lateral cricoarytenoid. Okay. Yes. Number three. Number three, from the cricoid arch, from the cricoid cartilage to thyroid cartilage. That is a cricothyroid muscle. Okay. And last, number four. See, number four is a muscle coming from the arytenoid to the thyroid cartilage. So number four is thyroarytenoid muscle. Okay. Yes. So these are the muscles we are seeing in this diagram. Now we're going to see the animation in the larynx. So now we're going to remove the skin and fascia. Yes, we are removing the fascia and we are seeing this cartilage. So larynx, a cartilage tube we are seeing. Now this is thyroid cartilage in the front like a shield. And below that, yes, we are seeing the cricoid cartilage. See, cricoid is the only cartilage which forms one complete ring. In the front side, it is arch and behind it is the lamina. Now above the lamina, you are seeing this cartilage, that is our arytenoid. And above, this is our epiglottis. Right. Now we are seeing the muscle there from the cricoid cartilage to the thyroid cartilage, that is our cricothyroid muscle. Now similarly, you are seeing on the, yes, from the cricoid lamina to the arytenoid on the posterior side, that is our posterior cricoarytenoid muscle. This is arytenoid cartilage. This is the lamina, posterior cricoarytenoid muscle. Okay, right. Now we're going to see the other muscles. For that, yes, we have to remove the thyroid cartilage. So now this is thyroid cartilage we have removed, and from the thyroid cartilage to the arytenoid, we are seeing this muscle, that is our thyroarytenoid muscle. Now just above that, from the thyroid cartilage to the epiglottis, and that is our thyroepiglotticus muscle. Thyroepiglotticus and thyroarytenoid. Now this is cricoid cartilage, so thyroid cartilage is a cricothyroid. So we remove the cricothyroid muscle. And we are seeing one more muscle there. That is our, yes, very good, one small muscle. That is our lateral cricoarytenoid muscle. Lateral cricoarytenoid muscle. Please don't forget this. Lateral cricoarytenoid muscle. And on the back side, we are seeing the posterior cricoarytenoid muscle. Clear? And now we are seeing the transverse arytenoid muscle. This is transverse arytenoid muscle. Okay, connecting the two arytenoid, transverse arytenoid muscle. Clear? Right. So now we're going to remove these muscles so that, yes, you can see the ligaments clearly. The vestibular ligament and the vocal ligament you can see here clearly. Yes, there is a vocalis muscle. We remove the vocalis muscle and we see the two ligaments here. Now this is above, that is the vestibular ligament, and this is below, that is the vocal ligament. Yes, now we're going to see two more muscles. Now see this muscle here. That muscle, that is the oblique arytenoid muscle. The oblique arytenoid muscle, which in turn continue as the airy epiglotticus muscle. Airy epiglotticus muscle is nothing but continuation of our oblique arytenoid muscle. Now the two muscles which act on the laryngeal inlet. One muscle will open the laryngeal inlet, one muscle close the laryngeal inlet. I told the mnemonic OT, operation theatre. Opening of the laryngeal inlet is done by our thyroepiglotticus muscle. Thyroepiglotticus muscle will open the laryngeal inlet, whereas airy epiglotticus muscle will close the laryngeal inlet. Okay? Yes, these are the muscles acting on the laryngeal inlet. So now in this animation module, yes, we have seen so many muscles and the cartilage. That's all about the animations in the larynx. Now, one last thing, nerve supply of larynx. So we have two nerves, superior and inferior laryngeal nerve. Inferior laryngeal nerve also known as recurrent laryngeal nerve. Now see the diagram. Now this is the superior laryngeal nerve. So superior laryngeal nerve, it is a branch of vagus nerve which is arising at the skull base itself. See, the vagus nerve, after coming out of jugular foramen, immediately below the jugular foramen, which is giving superior laryngeal nerve. So arising from the vagus nerve at the skull base itself. Skull base means immediately below the jugular foramen. Okay. And the superior laryngeal nerve travel all the way down, and which comes up to carotid triangle. That's a very important landmark. I told you already, the triangles of neck. In the carotid triangle, the anterior triangle of neck, the superior laryngeal nerve divided into internal laryngeal nerve and external laryngeal nerve. Internal nerve and external laryngeal nerve. See, internal laryngeal nerve, I told you already, internal laryngeal nerve is a sensory nerve, which is a sensory nerve, and that nerve carries sensory fibers from the supraglottis, that is above the vocal cord, which carries sensory fibers from the supraglottis. External laryngeal nerve, it is a motor nerve, which carries motor fibers to only one muscle. Which muscle? Cricothyroid muscle. Cricothyroid muscle. Okay? Right. This is about the superior laryngeal nerve. See the diagram? Superior laryngeal nerve in the carotid triangle divided into internal laryngeal nerve and external laryngeal nerve. Internal laryngeal nerve, sensory nerve. External laryngeal nerve, motor nerve. Okay? Right. Now next, our recurrent laryngeal nerve. Now we have the right and left recurrent laryngeal nerve. Their origin at different levels. The right recurrent laryngeal nerve is arising at the level of right subclavian artery. But the left recurrent laryngeal nerve arising still more downward, arising at the level of arch of aorta. Okay. So please write the recurrent laryngeal nerve. The recurrent laryngeal nerve, the right recurrent laryngeal nerve, which is arising at the right subclavian artery, arising at the level of right subclavian artery. The left recurrent nerve is arising at the arch of aorta. And then both nerves, yes, both right side, left side, they ascend in the tracheoesophageal groove. Tracheoesophageal groove. So again, tracheoesophageal groove is an important landmark for the recurrent laryngeal nerve. See, whenever they want to ask anything about recurrent laryngeal nerve injury, they will use this clue only. The surgeon, while removing the tumor from the larynx, mistakenly damages structure present in the tracheoesophageal groove. That means the surgeon damages the recurrent laryngeal nerve. Okay, see, you won't get the question directly like this. The nerve present in the tracheoesophageal groove, the content in the tracheoesophageal groove. No, you won't get the question like this. They will use this clue to frame the clinical question. Okay, so recurrent laryngeal nerve is present in the tracheoesophageal groove. Okay, so now we have two recurrent laryngeal nerve, right and left side. Now, which recurrent laryngeal nerve is having the longer course? See the diagram. The left recurrent laryngeal nerve arising at the level of arch of aorta. So, left recurrent laryngeal nerve is having longer course like this. So, which is the most commonly affected recurrent laryngeal nerve? Right or left? Left side. So, please write most commonly affected recurrent laryngeal nerve. Left side greater than right side. Why left side? Because left recurrent laryngeal nerve is having longer course. Okay, right. So now this recurrent laryngeal nerve, what is the function, sir? Mixed function. It is a mixed nerve which carries sensory fibers and also motor fibers. Okay, so recurrent laryngeal nerve, it is a mixed nerve. Motor supply to all the muscles of larynx. All the muscles of larynx except cricothyroid. Cricothyroid is the only muscle which is supplied by external laryngeal nerve. Remaining all the muscles of larynx are supplied by recurrent laryngeal nerve. And sensory fibers from the larynx in the below the vocal cord, from the subglottis and also from glottis. Okay, right. So this is about the recurrent laryngeal nerve. So recurrent laryngeal nerve is a mixed nerve which supplies all the muscles of larynx except cricothyroid and carries sensory fibers from the subglottis and also from glottis. Glottis main nerve supply is recurrent laryngeal nerve greater than interlaryngeal nerve. I told you already. Okay, right. Now see this diagram. Now this external laryngeal nerve is very close to superior thyroid artery, whereas recurrent laryngeal nerve is very close to inferior thyroid artery. Again, this relation is very important. So, superior thyroid artery is very close to external laryngeal nerve and inferior thyroid artery close to recurrent laryngeal nerve. Already I told you in the thyroid gland topic. Okay, right. Now, we're going to write the features of recurrent laryngeal nerve injury. Now, the patient is having unilateral recurrent laryngeal nerve palsy. So, unilateral side, one side, recurrent laryngeal nerve injury. Okay, right. Now, we're going to discuss the recurrent laryngeal nerve injury in three categories. First one, what will be the position of vocal cord? The position of vocal cord. Number two, what happened to the speech, the phonation? Now, do you see aspiration or not? And what happened to the respiration? So these are the headings. We're going to discuss the recurrent laryngeal nerve injury. First one, unilateral recurrent laryngeal nerve injury, one side. Now, in the affected side, all the muscles are paralyzed. Okay, in the affected side, all the muscles are paralyzed except only one muscle, cricothyroid muscle. Now, what is the action of cricothyroid muscle? Increase the tension greater than adduction. So, in the affected side, the vocal cord will be adducted position. For speech, to produce sound, for phonation, the two vocal cords should be adducted like this. Only then the air from below will vibrate the vocal cord, will produce a sound. Okay, for phonation, the two vocal cords should be adducted. Now, we have recurrent laryngeal nerve injury. Already in the affected side, the vocal cords are adducted position. Now, other side, muscles are normal. The recurrent laryngeal nerve normal. The superior laryngeal nerve is normal. So, in the normal side, adduction also normal. So, speech, yes, speech will be normal. Speech is not affected. Right. Next, Aspiration. Now, when you say aspiration, when the patient is not able to feel any foreign body entering the larynx. So the upper part of the larynx, supraglottis, supplied by which nerve? Internal laryngeal nerve. So only in the case of internal laryngeal nerve injury, you see the aspiration pneumonia. So aspiration is not seen. Now what happened to respiration? See, the affected side, the vocal cords are adducted. In the normal side, abduction, adduction, both are normal only. So see the diagram. So this is the thyroid cartilage like this. And this is the vocal cord position. This is adducted like this. Vocal cords adducted like this. But in the other side, the abduction, adduction are normal. That is a normal side. Now through this gap, the air will pass from the larynx to the trachea. So respiration is normal. Okay. So for respiration, yes, we need some gap between the two vocal cords. So through this gap, air from larynx will go to trachea. So in the affected side, the vocal cords are adducted. Okay. But in the normal side, that is the recurrent laryngeal nerve is normal. So abduction is normal. So now we have some gap between the two vocal cords. Through that gap, air will go to trachea. Okay. Right. So these are the features you will see in the unilateral recurrent laryngeal nerve injury. Now the patient is having bilateral recurrent laryngeal nerve palsy. So both side recurrent laryngeal nerve injury. So in both sides, the vocal cords are adducted. Okay. So both sides, the vocal cords are adducted like this. Abduction is not possible because both sides recurrent laryngeal nerve injury. So vocal cords are adducted like this. Now this is the position required for producing sound. For phonation, we need the two vocal cords to be adducted like this. Now because of recurrent laryngeal nerve injury, the two vocal cords are adducted like this. So phonation, speech is normal. Now do you see aspiration? No, aspiration is not seen. And last one, what happened to respiration? Now the two vocal cords are adducted position like this. So now we don't see any gap between the two vocal cords. So air from the larynx, they do not enter the trachea. So patient have breathing difficulty. The patient have stridor. So patient have stridor. So when the patient will have stridor, when the two vocal cords are adducted because of bilateral recurrent laryngeal nerve injury. Okay. Yes. So these are the features you will see in the bilateral recurrent laryngeal nerve injury. See in the exams, they can give you the features. The patient, both vocal cords are adducted, speech is normal, aspiration not seen, patient is having stridor. Now what is the nerve affected? Unilateral recurrent laryngeal nerve injury, bilateral recurrent laryngeal nerve injury, unilateral superior laryngeal nerve, bilateral superior laryngeal nerve. Likewise, they will frame the question. Okay, very important topic. And in the recent exams, we are getting one questions. Okay, from this topic. Now one last thing in the larynx is the pre-epiglottic space. Now the pre-epiglottic space is nothing but the space provide the cushion for the larynx. Now what is the boundary for the pre-epiglottic space? Pre-epiglottis. Again, name itself we have a clue. Now this is space present in front of epiglottis. Okay. Now what is the boundary for the pre-epiglottic space? Now anteriorly, this is front side, anterior side, this is back side. Now anteriorly we have the hyoid bone. Okay. And below the hyoid bone, we have thyrohyoid membrane. Thyrohyoid membrane, and then thyroid cartilage. This is the front side. Back side, posteriorly, we have epiglottis. Posteriorly, epiglottis. Okay. And above, we have hyoepiglottic ligament. Hyoepiglottic ligament. Below, thyroepiglottic ligament. Below, thyroepiglottic ligament. So what is the content? So content, we are seeing only the fat. Content, we see only fat. So I told you already. So this gives the cushioning for the larynx. Now one more point. Now cancer from the supraglottis. The patient is having cancer in the supraglottis, which will perforate the epiglottis, and it may come to the pre-epiglottic space. So the last point, the applied, the cancer in the supraglottis perforate the epiglottis and reach the pre-epiglottic space. pre-epiglottic space. Okay, I told already the cancer CA glottis is having good prognosis because no lymphatics, whereas supraglottis and subglottis, they are rich in lymphatics. Okay, now the cancer from the supraglottis perforate the epiglottis and it may come to the pre-epiglottic space. Okay, right, that's all about the space of larynx, the pre-epiglottic space. And by this, yes, we are concluding the larynx. Larynx is a very big topic, high yield topic. Every year in the NEET exam, INACT, FMJ exam, we are getting 1 or 2 questions from the larynx. Okay, right. So that's all about the larynx.